Hello, my name is Elizabeth. I'm going to be the nurse today. Can I get your name and date of birth? Minnie 7/23/2001. That is correct. So I understand today we are going to do a head-to-toe assessment. Is that alright with you? Alright. And I'm going to go ahead and provide privacy. Go ahead and wash my hands and put some gloves on. And as I'm assessing my patient, when they came in, their gait was good, the hearing seemed to be good, they're talking fine, their speech is fine, they're mobile, their posture is good, they're alert, the dress was good. I did not see any abnormal deformities. And also I'm going to ask her what her pain is on a scale of 0 to 10. So on a scale of 0 to 10, what is your pain today? 0 being none, 10 being the worst. 0. Okay. Well, that is good. Alright, so I'm going to go ahead and palpate your head, if that's okay with you. While I'm palpating, I'm looking at the hair distribution, looking for any lice, any lesions, any bumps, any bruising. There's none of that. It all looks good to me. Alright, now from there, I'm going to go ahead and palpate the frontal and maxillary sinuses. Go ahead and tell me if there is any pain, any tenderness. And also, at the start of my video, I also say that I took their weight, their vitals, and their height as well. So there was no tenderness there. I'm going to go ahead and look at your lacrimal glands. Make sure it's pink, no redness. Okay, that looks good to me. And also, as I assess the patient, I'm looking at her eyebrows, her sclera, the cornea, and making sure everything is symmetrical. So that looks good. Let's see. Next, I'm going to go ahead and start with the eyes. So I'm going to go ahead and start with the eyes. So first, I'm going to start with the chart. So go ahead and look up there and read the smallest line you can for me. Okay, A, B, C, D, and E. Okay, cover one eye and do the same. A, B, C, D, E. We did this on both sides. Our vision is good. Okay, so now I'm going to go ahead and check for pupil dilation in both eyes. That looks good to me. I'm going to check to make sure it's symmetrical in both of the eyes. Okay, reflex on both. I'm going to go ahead and, let's see, I'm going to go ahead and check for the proximal to make sure it's all good. Alright, her eyes followed. Now I'm going to ask the patient to go ahead and follow my pen light. Okay. She's going back and forth. There's no bouncing, no wobbling. She's following perfect. Alright. Now I'm going to go ahead and have the patient follow my pen light again. Make sure there's no difficulties. Okay, that was good. Go ahead and close one of your eyes and tell me when you can see my fingers. Now, and now. Okay, that was good. So I believe that is it for the eyes. Now we're going to go ahead and go to the nose. So first I'm going to inspect the nasal canal, the septum, and any turbinates. Alright, and I'm going to go ahead and look inside, making sure there's no blockage, no mucus is in the way, and now I'm going to go ahead and perform patency. So I'm going to go ahead and block one of the noses. Can you breathe fine? Yes. Okay, now the other. She had no trouble breathing with one of the noses closed. Alright, now I'm going to also ask the patient to smell this. What does that smell like? That is lavender, she said. So that was correct. Alright, so now I'm going to go ahead and move down to the mouth for the oral. So right now I'm assessing the lips. They're pink. There's no cuts, no bruising. They're not chapped. I'm going to go ahead and inspect the inside of the mouth, looking at the larynx and the throat and the gums and making sure she has all her teeth. The tongue looks good. Everything looks good. No cuts. Go ahead and stick out your tongue for me and say ah. Look again, and then at this time I would also check her gag reflex. Make sure she gagged okay. And then also I'm going to pretend I have something. Go ahead and tell me what that tastes like. So she said that tastes like salt, so that is correct. So there's no concerns there. Now moving forward, I'm going to go ahead and start with the ears. I'm going to go ahead and palpate the auricles, feel around, making sure those are okay. Okay, I'm going to go ahead and look at the tympanic membrane, pull up and back. I see it. There's no drainage, no fluid, no pus, so no concerns there either. Okay, and then now we're going to perform the Weber and Rhine test. So go ahead and tell me if this is an equal in both ears. Okay, that's equal in both. Alright, now I'm going to go ahead and perform the bone condensity. Go ahead and tell me when it stops. Okay, now, alright. And I would also do this on both sides on the patient. And now, now the air, go ahead and tell me when it stops. And now, okay, so I did that on both sides. Next, I'm going to go ahead and whisper a few things in your ear. Go ahead and tell me what they are. Dog, cat, and fish, that is correct. Her hearing is fine, that's not a concern. Now moving forward, I'm going to go ahead and palpate the lymph nodes. Make sure none of them are swollen. So there's no tenderness, they're not inflamed, they're not swollen. Moving forward, I'm also going to ask her to open and close her jaw to check the temporomandibular joint. Open and close. Alright, so there was no shifting, no sliding, no clicking. Now, moving forward, we're going to test cranial nerve number 7. Go ahead and wrinkle your forehead, grind your teeth, puff up your cheeks, stick out your tongue for me. Close your eyes for me. Okay, now we're going to test cranial nerve number 5. So go ahead and tell me when you feel a light touch, and go ahead and close your eyes. Okay, now, and now. Alright, so there's no concern there. She felt all the light touches. Now I'm going to go ahead and feel around the trachea and make sure that the thyroid is in place as well. Okay, make sure it's in line. Does any of this hurt? No, go ahead and swallow for me. Okay, no concern there either. It's all in place, intact. And now I'm going to also check for jugular vein distension. Go ahead, turn your head for me. I'm going to check her vein. There's no abnormalities. And then I can also feel it for the pulse, the carotid artery for the pulse. And then as of this time, I'm going to ask her to lift her head up, down, side, and side. So she did that and there is no concern. I'm going to ask her to shrug her shoulders as well. She did that perfect. Okay, now with resistance, go ahead and turn your head towards me. Okay, and now the other side, and up, and down, and shrug your shoulders. Okay, so that was with resistance, and she had no problem doing that either. Alright, now moving forward, I am going to go ahead and start with the back, so I'm going to go ahead and move the camera so you can see what I'm doing. And I'd also not leave the patient's side until I put the bedroll up, but for now, to save some time, I'm just going to verbalize it. Okay, I'm going to go on the other side, and I'm also going to keep her privacy, make sure she's comfortable at any times. So just go ahead and let me know if you're not comfortable with anything. I'm going to go ahead and readjust the camera and make sure she is comfortable. Okay. Okay, I think that should do it. Okay, so first, I'm going to examine the back of the hair distribution, make sure there's no lesions, no cuts, nothing like that. I don't see any of that. Now I'm going to go ahead and feel for the spine curvature. Okay, so I don't have any concerns about her spine. It's curved like normally down the center. Now I'm going to also check up here by the scapula, make sure that's all good. Okay, now I'm going to go ahead and percuss the spine for resonance and make sure everything sounds good. Are you feeling any pain today with me doing this? Okay, now I'm going to do the same for up here on the shoulder blade. Tell me if there's any pain, no pain. Okay, and everything to me sounds good. I'm also going to check for kidney tenderness. Is that painful at all? No? Okay. Now I'm going to ask you to go ahead and breathe in and breathe out. So I'm checking for thoracic expansion. Next, I'm going to ask you to say 99. So say 99, 99, 99, and 99. Okay, so that was good. Now I'm going to go ahead and listen to the lungs. Okay. One. Cycle 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. So when I assess the lungs, I'm listening for any bronchi, any wheezing, any crackling, anything abnormal. From what I heard, it was clear, there was no obstruction, no blockage. So that was good to me. Alright, so that was good. Now I'm going to go ahead and lean you back, nice and gentle. And while we are here, I'm just going to adjust the camera just a little bit so you can see up here. Okay. So now I'm going to assess the heart. So here's the aortic, the pulmonic, the second pulmonic, the tricuspid, the mitral or apical, and this is also the point of PMI. Okay, so that sounds good to me as well. Now I'm going to make sure her privacy is maintained. Now I'm going to assess the abdomen if that's alright. Alright, she said that is fine. Okay, now I'm going to look at the abdomen, see if I see any bruising, any lesions, any cuts. I'm not seeing any of that. Now I'm going to go ahead and assess the abdomen. So first, I inspected it. I can go ahead and listen to it, and I'm going to do this for 1 minute each in each quadrant, starting from the right, lower, left quadrant, going clockwise. So listen here for 1 minute, and I'm going to make my way up. 1 minute, 1 minute, and 1 minute. So here I was listening for normal bowel sounds, and making sure it wasn't quiet, making sure that I can hear certain things. Now I'm gonna go ahead and I'm gonna palpate lightly, so you might feel a little tenderness, and just go ahead and if you do, tell me. So push in a little bit, push in, and push in. And you can do this lightly, moderate, and deeply, but for this video I'm just gonna go ahead and do it lightly like I just did. Was there any pain? No? Okay. And then also I'd like to point out the arteries. So up here is the aortic artery, the renal artery, the iliac artery, and then the femoral was down below. And then also the femoral or the inguinal arteries are down here below by the pubic area, and you can assess those as well. Let's see. Alright, so now I can cover her up because she's all good there. I can go ahead and move on to the arms. So I'm going to go ahead and assess the arm, the hand, and look at it. Make sure the hair distribution is good. Make sure there's no lesions, no cuts. And right here is the radial, the ulnar, the brachial, and that's that. And then the epitrochlear node is up here by the elbow. You can also palpate that to feel if it's swollen or not. And to me, it was not swollen from what I assessed. And her skin was warm to the touch. There's no concerns there. Now I'm going to ask her to do some range of motion with me. So first we're going to go ahead and lift your arm up like this and down. And now we're going to go all the way up and down. And go ahead and let me know if there is any pain at any time. Okay, and then I'm going to go ahead and do the wrist. Up, down, side, side. Any pain? No. So her range of motion seemed good to me. We can also go out and in for the arms. Seemed good. There's a few reflexes. You could check the deltoid, the brachial for reflexes as well. Alright, so I did that on both sides. Make sure she's nice and covered. Okay, I'm going to go ahead and move the camera. Okay. So now I am going to, I can pull that up, but since I'm right here, I would not usually leave it down. So now we're going to go ahead and assess the legs, if that's alright with you, maintaining privacy. So I'm just going to pull it out enough that I can examine it. So go ahead and wiggle your toes for me. Alright, that was good. I'm going to ask you if your toe is up or down. So I'm going to move it up. So she would say up because she would feel that, or down if that was the case. I'm examining the leg. The hair distribution is good. Checking for capillary refill. That was good, and I can also check on the hand for capillary refill to make sure there is circulation. There's no bruises, there's no lesions, skin is warm to the touch. I can also perform the reflex on the patella. So what I would have her do is I'd have her scoot at the end of the bed, and I would tap right here, and her leg would come up like this. It would reflex, and I can also do that to her arm as well. And so the reflex was good. Now we're going to go ahead and do some range of motion while maintaining privacy. So I'm going to have you lift your leg up, bring it back down, and then knee up to your chest, down, and side, and then over. Make sure that's crossed. Okay, and then I'm going to do range of motion with your foot. So forward and back, side to side. So her range of motion was good. And did you feel any pain at all? No. So that's not a concern either. And for the other pulses, I can feel for the posterior tibial and then the dorsalis pedis for the pulse. And also up here at the top, I would listen for the carotid arteries for any bruits. So I'm going to go ahead and do that. Okay, so that was good. Could hear a beat and everything. Let's see what else. Before we start with the reflexes, just trying to think of anything that I have missed. Alright, I think that was good. Okay, so now I'm going to ask the patient to let me see their hand and look away and tell me what I draw in their hand. Okay, that was the number 8. You are correct. And now I'm going to go ahead and perform the vibration test. So go ahead and tell me where you feel vibrations. And I can go down here. So if she felt it, she would say the wrist and the ankle, and that would be correct. Next, I'm going to go ahead and perform the 2-point test. See if she can feel 2 points or 1 point. So go ahead and let me see your hand. And go ahead and tell me if it's 2 points or 1. That is 2. That is 1. That is correct. And also in the beginning, I would ask her what month it is, where she's at, and what today's date is to make sure that she's in the right mental state. Make sure everything's good. Okay, and then now I would also ask the patient to get up and walk for me heel to toe, just like this if they're able to. So I'm going to assess their gait, but I have already assessed their gait when they came in and sat in the chair. That was good. Next, I'm going to ask her if she can to bend over so I can check the curvature of her back, and then to lean back so I can check the curvature from the back side, and then to twist left and right to make sure she's able to do that. And then I would also ask her to go ahead, close her eyes, and balance on one foot, and then do the same for the other. I would also ask her to hop on one foot and then hop on the other. And yeah, so we're pretty much down to the end of the video. I'm just going to go ahead and take a minute to think about anything that I have missed. Okay, so that was that, and now we're at the end of the video, so I'd go ahead and go to the patient, and I'd ask her if she has any questions, any concerns, and I would let her know my findings, and then I would provide her some privacy to get changed, and then I would go ahead and take my gloves off, and then I would go ahead and sanitize, and then I would go ahead and document my findings.